Hi, my name is Zach Landis. I completed the Wills Cornea Fellowship this year, and I'm currently in a small group private practice in Lancaster, Pennsylvania. I feel very fortunate to have been a Wills Cornea Fellow, as it prepared me to become an independently practicing cornea specialist. First of all, from a surgical training perspective, I truly feel that Wills is second to none. Like all residents across the country this year, our training experience was impacted by COVID. Despite this, I was still able to perform over 100 corneal transplants, including more than 40 DSEC, more than 30 PK, more than 20 DMEC, as well as a handful of DALK, keratoprostheses, and corneal patch grafts as a primary surgeon. In addition to corneal transplants, Wills offers the opportunity to perform many intraocular lens exchanges, including Yamani and other various sutured techniques, as well as iris repair, and even assist with artificial iris implantation. Because of the breadth of these surgical cases, I feel very well prepared for complex surgical cases that come my way. In addition to the surgical training, the clinical training is also extremely strong. In clinic, you get the opportunity to see high volume of common corneal conditions such as ectasias, dystrophies, and degenerations, in addition to much more rare pathologies that are referred from all over the country. The Wills ER also serves as a source of acute and very interesting pathologies that give the fellow the opportunity for more autonomy and to teach residents along the way. Lastly, the faculty really make this fellowship an excellent learning environment through their investment in our education. At the end of clinic every day, they take the time to sit down and review interesting patients that were seen during the day. They spend time reviewing surgical cases and videos with us as well. And most importantly, they serve not only as educators, but as mentors and role models of excellent patient care. I have many fond memories from fellowship, but the most important memory to me was the opportunity to assist on a type 2 keratoprosthesis on a monocular woman who had a very rare cicatrizing disease and hand motion vision in her only eye. It was a combined case with Dr. Raber and the oculoplastic service, glaucoma service, and retina services. Within a few weeks post-operatively, she was 20/30 and could read for the first time in years. This is just one example of the opportunity to participate in very complex cases that can make a huge impact on a patient's quality of life. Fellowship was truly my favorite and most important year of training, and I'm very grateful for my experience at Wills.
Hi, I'm Mike Sluski. I was one of the Cornea Fellows at Wills, graduating June of 2020, and I'm currently on the faculty at Johns Hopkins. One of my favorite memories from fellowship was having the privilege of operating with Irv Raber on his last big OR day, in which we did a pterygium, a PK, a DALK, a DSEC, 2 DMECs, and a K-Pro. So it was really just like pitching the perfect day of cornea cases with one of my favorite mentors. But it also really just speaks to the sheer volume of cornea pathology, cornea transplant surgeries, as well as complex anterior segment surgery that we do as fellows at Wills. And just as an example, my first week here as a new faculty member, I had to do 2 urgent therapeutic PKs. And when we got in the OR, I didn't really have to think about the steps or think about what to do. I knew what to do because we had done it so many times as fellows. And then likewise, some of the other complex surgeries, I've done Gore-Tex fixated lens, Yamani, and again, those cases, I don't have to think about what to do. I knew what to do because we had done it so many times as fellows. So that's really the strength of this fellowship, that you can come out of here and really be able to tackle some of the most complex or toughest cases.
Hi everyone, my name is Matthew Shulman. I completed fellowship at Wills in the cornea department a couple years ago. Currently in my second year of kind of attending now, and I just wanted to talk briefly about how Wills prepared me extraordinarily well for my career now. I'm at a very busy private practice, multi-specialty, and there are a number of other cornea specialists here. And just as an anecdote, yesterday I was doing an ultra-thin DSEC using the Busin glide that most of us learned with in fellowship. And the majority of my cases are cataract surgery. I do some pterygium as well. And a few other cases, LASIK, PRK, things like that. But primarily it's cataract. But I still do plenty of cornea procedures. But I remember thinking to myself, this just seemed like second nature to me. And I made a kind of a joking remark to the surgical tech. I said, I guess I was paying attention in fellowship because the surgery just went perfectly well. It was like second nature to me. Wills faculty all of the amazing technicians and support staff just prepared me so well in terms of being able to see a very large volume of patients every day, a large complex population as well, and being able to manage my time both in the OR and in the clinic. And I really feel like that year I had tremendous growth clinically, personally, and surgically. And I wouldn't trade it for anything else. And it's really a tremendous program. And I'm still in touch with a lot of the people who I trained with and the faculty as well. And they'll remain, a family for me going forward. And I think it's a wonderful program, and I'm really grateful in terms of how Wills really prepared me for being in a very busy, complex clinical and surgical practice afterwards. And the DSEC patient, I saw him already, and he's looking great. And if you have any questions, please feel free to reach out to me. Take care.
Hi, my name is Avather, and I graduated fellowship in 2020. I'm currently in private practice in Wilmington, Delaware. My most memorable experience of fellowship was during the COVID-19 pandemic. The patient was scheduled for a DMAP, but due to limited corneal tissue, we had to use tissue from a 41-year-old patient. The younger the patient, the tighter the scroll, and the more difficult it is to open the graft. This was probably one of the most challenging DMACs that I did during fellowship, but with the guidance of Dr. Ayers, the case was a success. At Wills, you will gain experience in penetrating keratoplasty, DSEC, DMAC, secondary IOLs, and iris repair, giving you the clinical and surgical skill set needed for future practice. I felt that a year of fellowship significantly augmented my residency skills and allowed me to add value to the practice that I joined.